Well, Channel 3 has discovered millions of dollars worth of COVID-19 vaccine has been wasted in Tennessee, Georgia, North Carolina, and Alabama. More than 737,000 COVID vaccines have expired in those four states since the rollout began. It's a sign of the state of the pandemic for health leaders who are struggling to get vaccination rates up, specifically right here in our area. Channel 3's Liam Collins is following this and joins us live here in the studio with what he's learned about all of this. Liam.
And Latrice, about a third of that has been thrown away since Channel 3 first asked for those numbers on this about 2 months ago. And now this does not include vaccines that have been wasted because of improper handling or other areas. So we're only talking about those hundreds of thousands of vaccines that were thrown away after they sat for at least 1 month because there was simply no one to give them to, leading to a hefty price tag of nearly $15 million.
Now that we have it, we hope not to waste it.
Dr. Gary Vocchio remembers just earlier this year when interest in the COVID-19 vaccine far outweighed the supply available. Now it's quite the opposite.
That the vaccines are safe. They've been in place and have been researched for decades.
9 months into the vaccine rollout, and only 40% of people in Tennessee, Georgia, North Carolina, and Alabama are fully vaccinated. A waning interest, Channel 3 has learned, has cost millions in federal funding used to buy those shots. More than 737,000 COVID-19 vaccines have expired since the vaccine rollout began. At an estimated cost of $19.50 per dose, those four states have tossed out nearly $15 million in vaccines they couldn't find anyone to take.
If we have vaccines that we think we're not going to use, should we just give it as a booster? And that's a big question epidemiologists and physicians in the healthcare industry are looking at now.
Those ideas are in response to low vaccination rates while COVID hospitalizations soar. About a third of those wasted vaccines have been thrown away in the last 2 months, totaling over $4 million. A sign of the state of the pandemic, says Vocchio, as they prepare for more federal funding to handle the COVID crisis years down the road.
So when we see this, I interpret that as meaning even the CDC recognizes we're in for the long haul with this.
A long haul, and Vocchio says an uphill battle.
And get a vaccine after you've been informed. That's how we hope to do this, one arm at a time.
Now, those expired vaccines only account for about 2% of total doses delivered to those four states in our area. I also asked Vocchio if Pfizer's FDA approval made a difference at all in raising vaccine interest. He said just a little, and that a similar stamp of approval from Moderna and Johnson & Johnson may make a bit of a difference, but he doesn't expect that to happen until mid to late winter at the earliest. Latrice?
Thank you so much, Liam, for that live report there.